if you're concerned that your baby is mouthing absolutely everything, including toys, their fingers, or their thumb, or you're just curious as to why your baby may be doing this behavior, then this video is for you. In this video, I'm gonna cover all the reasons your baby may be mouthing their hands, toys, or fingers, and when to be concerned. But before we do, make sure you click on that free PDF document in the description box below, which covers the developmental milestones you can be expecting for your little one in first year of life. This will give you an invaluable peace of mind as you'll know what to be expecting and when to be concerned. Also, if you want to make parenting significantly easier, make sure you start now by subscribing to my channel, where you'll learn the tips and tricks I've learned over the last 10 years, practicing as a pediatric occupational therapist and being a mom to 2 children. So what are the reasons a baby may suck their hands, fingers, or toys in the first few months when they're a newborn? They tend to suck fingers or hand to indicate to you that they are hungry if you know they are not hungry. The other reason they'll be doing this is because it is actually a calming activity for your baby to do. It is really soothing. In fact, thumb sucking is a really calming activity that babies do in the womb. At 20 weeks gestation, you'll notice that babies continue to suck their fingers and thumb because it will soothe them to sleep, and it helps calm them when they're feeling a little bit stressed or overwhelmed. This is because when a baby is sucking their thumb or their fingers, the brain releases the hormones, dopamine, serotonin, and endorphins, which are relaxing happy hormones. Some babies may continue to suck their thumbs and their fingers into their toddler years because they use this technique to help themselves fall asleep, and also as a self-soothing technique when they're feeling stressed or overwhelmed. As a parent, you might be concerned that your baby sucking their finger or thumbs will impact on oral development. However, the American Dental Association has stated that thumb sucking and finger sucking does not usually cause a problem in the first few years of life. In fact, it isn't till your baby is around 4 years of age that they encourage you gently discourage thumb sucking. And what's great is that most children typically stop thumb sucking or finger sucking between the ages of 2 and 4. So I wouldn't be concerned if your baby is starting to suck their thumbs or their fingers to help soothe them during the day or fall asleep. The third reason your baby may be mouthing absolutely everything is because it is their way of exploring and playing. So at around 2 to 3 months of age, your baby first realizes that they have arms and hands and that they can control them, and they are absolutely blown away. So you'll see your baby really closely looking at your hands and starting to mouth them, particularly at 3 months of age, when they can put their hands in the middle of their body and they bring them up to their mouth. This is how your baby learns about texture, taste, and temperature of all items is by mouthing them. So initially, they'll mouth their hands, and then around 4 to 5 months, more towards the 5-month mark, when they can hold toys for a longer period of time, those toys in their hands will go straight in their mouth, because they're working out what the toy feels like, and what the toy tastes like, and what the toy's temperature is. As your baby gets older, you'll notice that they start to stop mouthing their hands, and they'll just mouth the toy. And as they get older, still at around 12 months, they tend to stop mouthing toys completely, because they have developed the fine motor skills to manipulate and play with toys, how they're meant to be played with. So they'll actually start to turn them in their hands, and they'll be able to use their sensors on their fingers to work out the touch of an object. And the temperature, the final reason your baby may be mouthing their hands or toys, is because they are teething. So, teething first typically occurs anywhere between 4 to 10 months of age. So the first 2 teeth that they typically get are the center teeth on the bottom of their mouth, and teething itself really hurts. So placing something against it, which they can rub against the gum, helps to relieve some of that pain. If your baby is teething, then you can do a few things. You can offer them a teething ring, or a teething toy, which they will munch on to try and relieve that pain, or a cool damp cloth such as a face washer, which they will put in their mouth and kind of stuck on, or pain relief in regards to medicine. If teething rings and the cool face washers just aren't doing it, then you can talk to your doctor in regards to what pain relief options there are for a baby. So, as you can see, There are multiple reasons why your baby will be putting toys or their fingers in their mouth, and there is nothing wrong with it. It is completely normal. What you want to do is make sure that you keep their hands relatively clean, 'cause they're gonna go in their mouth, and also that you wash their toys or objects that they're going to put in their mouth regularly. Make sure you click on that free PDF document in the description box below. And hopefully I'll see you next week, where I'll share more parenting tips and tricks.